Hey folks, Mr. Ellis here. So after talking to some of my students, I know that a lot of you are very curious about the COVID vaccine. All right, if we want to be done with these things, all right, we're going to need to learn a little bit about this vaccine because things that we don't know or understand, we tend to fear. And in this case, we need this vaccine. So let's do a little bit of learning and understand why we need this thing. First off, let's start with this. Up here, you see the list of deaths of the top countries in the world in terms of COVID deaths. All right, you see America sitting over there, number one. The reason I bring this up is because down here is South Korea. In the entirety of the pandemic, they've only lost 634 people to COVID. And the reason I bring that up is because there was a really united movement here in South Korea to make sure people were staying safe and doing the right things, okay? And the reason I bring that up is because sure, we may have a number of deaths so far and a lot of tragedy across the country, but we can still do some things about it as long as we work together. Yesterday alone in the U.S., 3,600 people died in one day. That's 6 times the total for the entirety of the pandemic in South Korea compared to just one day in the U.S. So there are things we can do, and number one, we have a vaccine, and vaccines can make a huge difference and a huge impact. So let's learn a little bit about those vaccines right now. For those who have been following the news here, medical professionals here, you can see a doctor here, Paul Conley. But anyways, he's getting his vaccine, all right? In fact, most medical professionals are going ahead and getting them. Number one, to show the public that it's safe, okay? Number two, because they're constantly exposed to COVID patients and they need to be kept healthy because we need our doctors and nurses and other medical professionals to stay healthy to keep people safe, okay? So various numbers of doctors and other at-risk people are currently taking it. We'll get to who gets to take the vaccine and when, but let's start talking about the vaccine and what needs to happen. Number one, according to our top medical professionals, we need to have 85% of our current population take this vaccine in order to reach that herd immunity status. In other words, where enough people are immune to it that the virus is not likely to spread in the population. Okay, 85% of us. All right, so about 8 to 9 out of every 10 people. Now, based off survey data right now, you can see here the number of people who would accept the COVID vaccine. Almost half of us will say definitely. A quarter of us here will say, yeah, I mean, pretty much sure, I'm kind of on board with it. But then we're still sitting here with about another quarter of us who just are not sure, or at least have no opinion. Okay, and we need to sway those people because right now, these two up here combine to about 72%, and we need to get that, if we can, up into the 80s. All right, and that means you people with no opinion, we need to start understanding the vaccine so that we're not afraid of it, so when we're given the opportunity, we can take it and keep each other safe. Now, moving through this, let's discuss the process of what this vaccine actually is. Number one, I know some people were like, how do we make this vaccine so fast? And we're actually going to kind of address that here. So if I may, these are some of the common vaccines that we've created across the years. As you can see, like polio vaccine, for example, took a while to figure out, okay? And it took a while to get done. In fact, most of these vaccines right here take a significant amount of time. COVID down here, our COVID vaccine was very quick, all right? And as for why? Because most of these old vaccines worked through using old or dead or somehow malfunctioning viruses and putting them into the human body so they wouldn't cause anybody to get the disease, but they would enable the immune system to respond. Okay? The COVID vaccine doesn't use that. It uses actually kind of new technology, which is called an mRNA vaccine. So let's talk about what that means. So you know how like when you're in science class or math class or social studies or language arts, you're like, what are we learning about this stuff? When is that? It matters now. Okay? Like every single person who decided to put their head down when they're learning about transcription and translation, you're about to get an education on why this is important, okay? We educate our population so we can make good informed decisions and not be scared of things that we should embrace. But anyways, let's continue with this before I get off the pedestal here. All right, so number one, when you have the COVID virus, coronavirus, okay? You see it's surrounded here by a membrane, and it's got these things called spike proteins. These are the little things that your immune system detects. Okay, so inside here is the COVID virus, and then here are the spike proteins on the outside. That's what your cell detects when it sees that the virus is there. So what we decided to do is, and by the way, what detects it are these white blood cells, as you see here. They move through your body, they detect these spike proteins, and then they go and create antibodies to stop them. So what we want to do is this. We want to introduce these spike proteins into your body. And if we can introduce the spike proteins into your body, your immune system should respond. We'll start up here with this. All of you recognize DNA, right? Well, through transcription process, for those in biology, you have some idea what transcription is, where you take the DNA and turn it into RNA, okay? And then that RNA is used to translate protein, all right? Basically creating proteins. And remember, we were just talking about spike proteins a second ago. The whole idea of mRNA here, all right, is to basically create proteins. The COVID vaccine is an mRNA vaccine. So we're going to make proteins. So think of it like this. DNA typically stays inside the nucleus, all right? Then it releases out mRNA, or messenger RNA. That mRNA is used to build proteins. These proteins then go to the surface of the cell where they sit, and you can make a little spike protein there. Okay, so what we're essentially doing is we're putting in messenger RNA, all right, and that messenger RNA will be in your cells, and then it will actually make proteins on the outside. These proteins are not going to be an issue for you, okay? They're just merely to help us identify this virus. So you're putting spike proteins on some of your cells, and your immune system will recognize these proteins as foreign and then create antibodies against them, okay? But here's the cool part. The mRNA produced here, all right, from the vaccine, it can't get into your nucleus. It can't affect your DNA. It doesn't do anything beyond go into your cell and make protein. And then these proteins, the spike ones, go to the edge of your cell and basically show off to the immune system what this virus looks like. So before you're even infected, your immune system is prepared and ready with antibodies against these spike proteins you've created. So over here, let me kind of show what I mean. Here's your COVID. Okay, you see the little spike proteins all around it, right? So why we were able to do this so quickly is because we created an mRNA sequence, which really didn't take all that long. Okay, this is how the Copic vaccine works. You create an mRNA sequence, and what we do is we put it inside a little capsule. In fact, this, I don't know why it's not letting me write in red here, but if I get it to work. Okay, there we go. This is a nano capsule right here. In other words, it's like super small stuff. People mention these words like nanotechnology. That's not what this is. It's just a tiny little lipid, okay? Lipids are like bubbles. It's just your cell membrane. So it makes a little membrane, right, to go around the mRNA, which goes in there. Because when you put it into your cell, you need to have something protecting it. Otherwise, it will get broken down. So you put it in a lipid, right? And so if we move through here, you take these lipids, right, with the mRNA in it, and you put it into the vaccine, which you then put into people's bodies. And then what happens is this goes into your cell, and it releases the mRNA. And inside your cell, your mRNA gets translated into protein. That's the point, right? DNA's job is to make protein, and these proteins go to the edge of your cell. Now, once they are on the edge of your cell, here's what happens. Your body starts making antibodies. Antibodies protect your cells by binding to these spike proteins and not letting them work. Okay? So your body notices these foreign things, it starts to make antibodies, and then when the real virus shows up, your antibodies are already ready there to incapacitate it so you cannot get the infection. Okay? It's all super clever. It was all super fast because it's super clever. Okay? Now, if I can, continuing about this, what can you expect? If you've all gotten a shot before in your arm, all right, you probably noticed that their arm hurt, okay? If your arm hurts, right, or you get like a little bit of like a fever or a chill after a vaccine, that is good, all right? The only time you actually should be concerned is when you get a vaccine shot and you don't feel any pain and you don't have any kind of chills, okay? Because the pain is caused by white blood cells rushing to the area to do their job and attack something foreign, okay? Your fever and chills, okay, is caused by your immune system responding to what it perceives as a threat. It means the vaccine is working. When you don't get those things, you actually should be concerned that the vaccine didn't take, okay? So if I can, common side effects here of the COVID vaccine, one, the arm where you get the shot, you should expect pain and swelling. Again, simply caused by the white blood cells going there. Through the rest of your body, fever, chills, tiredness, headache, typical things your body does to react to an infection. Okay, so again, it doesn't mean that you've got COVID, okay? This just means your body is responding to a perceived infection. But remember, it's a fake infection. The whole thing's fake. You're just tricking your body into reacting ahead of time. So this right here is good, okay? And it will go away soon, and again, it will not cause you any issues in the long run, okay? Now, let me see here. How about the vaccine itself? Its price? It's free. Who's paying for it? According to the CDC, right? Our taxpayer dollars, number one, so I guess we're paying for it. But at the end of the day, I will also be given to the American people at no cost to yourselves, at least in person, right? Versus your tax dollars there. Now, if I can continue here, who gets this vaccine? All right, so in terms of who actually gets this vaccine, it kind of depends. All right, number one, we want our medical professionals to have it because we don't want to lose them, because if we lose them, then people will die from more than just COVID, right? We cannot save people from heart attacks or other diseases that we normally need health professionals for. So we've got to save them first and keep them up and running. Now, if we can, who gets it and when? People who are regularly exposed, like medical professionals, to COVID-19. Also, your age. As we know, older people are way more significantly affected by COVID. So older people are typically going to get this first. All right, your medical history, people with pre-existing conditions, those are the people who are a big threat. If you're older and you have pre-existing conditions, right, like whether that's asthma, COPD, obesity, diabetes, these other things can cause issues as well if you catch COVID. So we want to give them the vaccine first. And then here, where you live, some places are kind of doing poorly right now in the U.S. with their COVID response. So some places are doing well, there's less virus around, so it's less of a serious threat, okay? In other parts of the U.S., you're gonna need to have it because it's everywhere, okay? Now, if I can, in terms of this specifically, phasing it out, when can you maybe expect to get your vaccine? Well, if you take a look right here, you have different phases, right? High-risk people, first responders, like our health professionals. Phase 2, teachers are in there because we're around so many people, which puts us at higher risk. And then over here, that's when we start getting to young adults and children in phase 3. Okay? So what we imagine is it all kind of depends on how many vaccines we have. We currently have 1. I think 2 more are about to be authorized. So the more vaccines we have, the quicker this can roll out. But I think for the general public, right, for most everybody else, this will be available probably sometime around in June. Okay? And assuming we get everybody vaccinated, that puts us somewhere at the end of 2021, right? In the fall or winter of 2021, where we've gotten to the point where we've gotten enough people vaccinated that life can return to somewhat, some semblance of normal, or at least without as much fear as usual, okay? But these are the big things to know about with COVID I wanted to make sure that I addressed. And honestly, if there's any other questions I can answer, you're always welcome to come to me and ask. Email me, all right, message me on Canvas, whatever, okay? I hope some of this helped calm some of your fears, and hopefully you can explain to people what's going on inside the vaccine. It's not, what are some of the conspiracy theories? It's not like radio frequency stuff. It's just nonsense, guys. It's just an mRNA vaccine that goes in your cells and produces the spike proteins so your immune system can respond, all right? That's why all the medical professionals are also going first, because you know, they know what's in it, and they're willing, again, they know the risk, and they're willing to take it. Oh, there is one more thing. People who are actually at risk of this, okay, people who should not take the vaccine include people who have allergies, like severe allergies. Not like just like sniffly nose like I have, okay? I'm talking like who respond poorly to most medicines or other issues because they have allergic reactions intensely, okay? Because when people who have those severe allergic reactions take the COVID vaccine, sometimes they react poorly. And they can be easily, you know, helped with a simple epinephrine shot. Okay, so if there is a bad reaction, it's easy to take care of that. However, it's just that's the one serious side effect we've seen on people, is that people who have severe allergies might be at more risk, specifically from the vaccine, in terms of their allergic reaction to it. Okay, but again, EpiPen, simple enough, save on that. So these are things that we're all considering, and we're still kind of going through the process on, but keep this in mind. We've already had 20,000 people take the Pfizer vaccine. 20,000. It's been thoroughly tested before it's been given to anybody. Okay? So keep that in mind. Okay? This is not, we're just trying it out. We're going to wait and see. We've already tried it out. That's why it took so long to get the vaccine. It was actually already here back in the summer. We already had a vaccine ready to go, but we had to test it out first. Okay? So it's there. It's safe. And hopefully we'll get things back to normal soon. Anyways, I'll take care.